Daniel Palestrand is a practicing physician and the founder of Sermo, an interactive online forum for doctors. With more than 115,000 members, he suggests that the motivation of the AMA to endorse the president's plan might have stemmed from a desire to keep their revenue stream from billing codes rather than representing the voice of the doctors.
The codes, these billing codes, are known as CPT codes, current procedure terminology codes. And for someone who's not familiar with sort of the healthcare ecosystem, think about CPT codes kind of like ticker symbols are to Wall Street. So if you want to interact with the healthcare system, whether it's as a doctor, a hospital, or an insurance company, you have to use these codes.
Dr. Palestrand says when the government first introduced the CPT codes, they entrusted them to the AMA because almost 100% of American physicians were members, and most of their revenue, about $20 million, came from membership dues. But once the AMA received sole proprietorship of the codes, their revenue grew to more than $300 million. At the same time, their membership was drastically declining.
What the government did, perhaps without realizing it, was they created a government monopoly. The ramifications of that have been tremendous, because now what's happened is that the AMA is able to charge anyone who interacts with the healthcare system for the use of those codes. But I think it's been intriguing to all parties why the AMA endorsed this bill after less than 48 hours, why the AMA was willing to support a bill that clearly physicians are so against. And it is troubling that under this bill, the AMA's revenue from these CPT codes will explode.
Even a former president of the AMA disagrees with the decision to back the bill.
I believe this is a tremendous hurt to the AMA, the membership, because of their position on H.R. 3200. And what they need to do is get the policy of the AMA that protects patients and allows doctors to stay in practice. And when that policy is in a bill, then endorse the bill.
We did try contacting the AMA, but they didn't return our phone calls or our emails. Perhaps to show he had more support outside of the AMA, on October 5th, the president invited 50 doctors to the White House Rose Garden, one from every state.
I am thrilled to have all of you here today, and you look very spiffy in your coats.
Soon after that meeting took place, this photograph circulated of a White House staffer handing out white coats to all the doctors before the president spoke. Dr. Eric Novak was set to be one of those doctors, but declined that invitation.
That was, I think, an embarrassment for the profession. As someone who has been extremely involved both locally and nationally in terms of healthcare policy, I was pretty stunned that they didn't have an answer or did not know already that perhaps I was not exactly the right guy to be standing behind the president in support. Was totally stunned that the White House didn't even do the slightest bit of vetting, that apparently the staffers in the White House didn't even use Google.
But some doctors aren't waiting around for a health care bill to change the way they practice medicine. One New York doctor says he's come up with a solution to treat the uninsured here in America. He calls it the $79 plan. Similar to a gym membership, a patient pays $79 a month and can come in here for unlimited checkups. Dr. John Mooney says his plan is a direct contract between the patient and the doctor and cuts out the bureaucracy of big insurance and pharmaceutical companies.
We are able to provide 80% of people's medical care, medical needs, 80%. That's a huge number. From minor surgeries to blood work, to medical exams, to preventive care, to physical therapy, to x-ray, sonogram, everything is included in the $79.
Our message is loud and clear. We really care about the health care of the patients in this country. They don't, and we're not going to rest until they get this right.
Now, that is an innovative plan. Now, coming up next, one woman describes her personal story of survival and how she believes that she owes her life to the current American healthcare system. 5 years ago, Maeve Rice had the same pressures of any other working mother trying to juggle her career and family. Then one day she was stunned with the news that she might have breast cancer.
It was very hard. I mean, obviously I had little girls. My oldest was just turned 8. My youngest was 6. So that's what you think about.
Instantly, she went from wife and mother to, quote, patient.
I went to Faulkner Hospital on a Thursday. The following afternoon, I received a call that, in fact, the biopsy had come back and I had breast cancer and that it was an aggressive breast cancer. So that I needed to take care of it right away. So I immediately hung up the phone, called Dana-Farber Cancer Institute, spoke to a wonderful woman, said, I have cancer, I don't know what to do, I have little girls. And she set me up with Dr. Gulshan, who's a breast oncology surgeon. I had the biopsy on Thursday, I had the results on Friday, and on Tuesday I was in meeting with Dr. Gulshan.
We've made it a policy that we want to see, women with a diagnosis within 5 business days. Even that sometimes is too long for the woman. Whenever someone comes in with breast cancer, the diagnosis is absolutely overwhelming for the person, for their significant other, for their children.
I was somewhat prepared, but you just think about your children. I had a job to do, which was to take care of them and get better. So I was like a warrior.
And she needed to be. Maeve's condition was serious.
Maeve presented with what's called a multicentric breast cancer. So she had an invasive breast cancer that was in several areas.
When we looked at the pictures on the MRI, there was more than actually one spot of cancer.
Dr. Gulshan immediately operated, and Maeve began a long, intensive battle that would last for years.
The people at Dana-Farber were excellent. They gave us a lot of support. My doctors were wonderful with the children. They came with me to a lot of appointments. My family was incredible. My friends were incredible. The neighbors, the community was great. So with all that support, I was really fortunate to be able to make it through the surgery, make it through the long treatment. I had treatment for about 1.5 years.
And she was lucky. Right around this time, a new drug had become available, called Herceptin.
What we know about Herceptin is that for women with this type of breast cancer, that it reduces the risk of recurrence by about half. And that has changed how we treat this type of breast cancer.
While it was a curse to get the breast cancer, there was sort of the silver lining of knowing that they had this new wonder drug that was going to make a real difference in terms of preventing the reoccurrence.
But at the same time, a public battle over the use of Herceptin was breaking out in the United Kingdom.
I was excited to get it and thrilled that I had access to the drug. It is an expensive drug. And while I was undergoing treatment, I was receiving all kinds of emails about women that were living in the UK who had the same kind of breast cancer I had, but weren't able to access the drug because of the drug cost and that their insurance wasn't taking care of it. It wasn't allowing them to receive that treatment, which was life-saving for them.
The survival benefit in reducing the chances of this cancer coming back significantly by over 50% is a pretty amazing thing. And yes, it is an expensive drug, but it's a drug that's actually been proven.
But the United Kingdom is home to the NHS, the world's largest publicly funded health service. And as Maeve was starting her Herceptin treatment, British women were fighting to get the government to pay for the drug. Anne-Marie Rogers became the public face of that fight. She sued the NHS after being diagnosed with the same kind of breast cancer as Maeve and being denied Herceptin treatment. So Anne-Marie took her fight to court and raised over $8,000 to buy the drug herself. As the case dragged on, breast cancer patients who badly needed the drug would show up at court in solidarity. Eventually, Anne-Marie prevailed, but sadly, she passed away last year. Thousands of women now benefit from the battle that Anne-Marie waged. But critics still say the government-run NHS system is flawed.
Can't choose your doctor, can't choose your specialist in many cases. You can't choose where you go to. It rations. It tells me, as a cancer specialist, which drugs I can use and which drugs I can't.
Oh, remember all the ladybugs on your land?
5 years later, Maeve is now doing well.
Right now, she has no evidence that there's any cancer anyplace, and she's doing very well, and she actually has a very good long-term prognosis. Unfortunately, as she knows, I never get to tell her whether or not she's cured.
But she worries about what could be coming down the line if the entire U.S. healthcare system is overhauled with a government-run system.
What was amazing is that I was able to get to some of the best doctors in the world with a phone call and no wait. And the fact that I could call Dana-Farber Cancer Institute on a Friday afternoon and be there on a Tuesday with an appointment, and 2 weeks later be in surgery with 2 physicians, it was amazing to me. And it gave me a lot of hope.
One of the major benefits is to come to a cancer center like this, where we do offer things that a lot of places in the country and around the world do not have. And most of the standards in cancer therapy comes from the United States, especially for breast cancer.
When you see